Good morning and welcome to the Senior Hour. I'm Dr. G. Dorio with my co-host Barbara Cochran on your hometown station AM 1220 KHTS. This is a show for, about, and by seniors, bringing information to enhance one's quality of life. Barbara's not here today, but we do have Robin Clow from the Senior Center. Robin, welcome to the show.
Thanks so much. It's wonderful to be here, and I have some exciting information to talk to you about sometime during this show.
Sure, we'll bring it up a little bit later, but we are joined today by two distinguished guests on our show coming from City of Hope. And, you know, one of the when I first came to Santa Clarita, I think one of the things that I found was that we had a dearth of physicians and ability to provide good medicine here. And that's just the opposite now. So we are joined by Tricia Eugenio today, who's at Providence Holy Cross, and Dr. Chu from Providence Holy Cross and also City of Hope.
Yes.
And, let's talk a little bit about the care that has enhanced this community now by having City of Hope here. Tricia, what does City of Hope bring to Santa Clarita?
Thank you very much for having both of us out here. I'm actually an oncology nurse navigator for Providence Holy Cross, and we are in partnership with City of Hope Santa Clarita office out here to provide access to our oncology patients here in Santa Clarita. So our City of Hope office here has several oncologists, and we have a new addition, our breast surgeon, Dr. Dortha Chu here.
Well, welcome to the show,
well, thank
Dr.
you very
Chu.
much.
In the past, I remember when I was at Baylor in the 1970s, late 70s, there were no female surgeons at all. And all the programs that were there, it was incredibly, to me, a problem because I felt if I had a daughter, that she would not have that opportunity. But here you are, Dr. Chu. Here you are practicing and bringing your talents to our community. Tell us about the breast problems that you see and face us in our female patients.
Well, first of all, again, thank you so much for inviting us. It's truly an honor to be here, and I do appreciate the comment about there aren't too many of us. Although I think female surgeons, but I think we're on the rise, and I'm excited about the fact that I think we do maybe provide a little bit different perspective on treatment with our female patients and male patients too. But in my particular field, I deal with breast cancer, and that's pretty much all I do. So, so the majority of my patients are female. I do randomly every once in a while have a male patient, but the vast majority are female. So I think I like to think that I'm able to provide a little different perspective for my patients.
Right, definitely a comfort level with you being a female, also being able to empathize and identify with them. And it's so wonderful that both of you are here and in this oncology field. It's wonderful to have the proximity, because when you're dealing with that type of emotional and physical illness, it's you really don't want to be traveling far or whatever. To have you right here, the best that there can be right here in Santa Clarita is just wonderful.
Can I just bring in, I was alluding to, training and not seeing any female surgeons, but, one of the issues that is not discussed much is breast cancer in males.
Yes.
And you just mentioned that, Dr. Chu, and, I think it's important that our seniors who are out there who might be thinking, what is this that I have in my breast, but it's a guy.
Sure.
What should guys do in terms of making sure that they don't become a problem? Because statistically, yes, it might be less than 10%, but statistically, men have problems with breast cancer as well.
Oh, absolutely. And I think actually for both men and women, especially I found in some of my older patients, it is that reluctance to kind of discuss
absolutely
questions or concerns about the breast to some of their regular doctors, whether it's a generational or gender gap. In any case, I think it is hard. And so sometimes they may sort of have issues or questions and they're just not expressing it. And the vast majority of changes in the breast in both men and women as we get older can be confusing. And they can be confused for cancer changes without it being cancer. The vast majority of these changes will not be cancerous, but it's something that they may not be aware of because they're afraid to ask. And so I do have a lot of older patients who have had issues for weeks, months, even sometimes years before they sort of muster up the courage or it has bothered them enough that they bring it up. And I'm glad to say that the vast majority of time I can actually reassure them that it's not a cancer problem, especially in males. It is very common for older males to develop sort of excess breast tissue. Usually it's more of a fatty tissue, which is why I said it's very rare for it to be a cancerous change. But sometimes it can be, it can be. And there isn't a great screening protocol for men because the male tissue is not quite the same as the female tissue. And so the kind of imaging that we talk about, like mammograms that we do for women routinely, really isn't something we recommend as a routine for men. Just the effectiveness and the ability to find things is using that imaging is not great enough in men for us to recommend it for everybody. But certainly if there was a concern, those would be things that we think about. And I think it really is something that unfortunately can become a problem in our older patients because
it becomes a problem because one of the reasons is men don't find it soon enough, and when they do find it, then it's a big problem. You've gotten to a different stage of trying to treat it.
Absolutely. And for men and women, I was about to say, I find a lot of older patients become, I guess, either reluctant to discuss their symptoms with their doctors. Some are under the impression that once you reach a certain age, that you will not get breast cancer, and male or female, and therefore you don't need to be screened any further. And sometimes that's even perpetuated by their doctors to a certain extent, that if you get to a certain age, you don't need to do mammograms anymore because you won't get cancer. And that's just, that's not the reality. And for men too, they get dismissed, that's just the benign changes we expect in men. And so, don't worry about it, go home, come back in 6 months and we'll check it again. And so I think a lot of times because of the age of these patients that they're dismissed and just, it's not going to be an issue, don't worry about it. And what we know for sure is that and it's been shown over and over again in studies that older women can get breast cancer. In fact, the risk goes up as you age. Slowly, but they do go up. But if we catch the cancers at an early stage, then we can, with the proper use of mammograms and exams, they're essentially curable 100% of the time. In fact, it's not just that they are curable, but that we have to do less for them in a way. Older women past the age of 70, if they have an early stage cancer, they typically don't even need radiation, for example. But if you wait too long and you're at a later stage, even curable, you're going to have to do more. So I think it really is something to keep in mind that this is not something that you deal with when you're younger. This is something that's a lifelong care that you need to continue.
Dr. Chu, is there a cutoff though for our senior patients, like in terms of years, like somebody above 80, you don't do any more mammograms? I am not of that belief, but I have heard people say that, women say that, and I think that's almost a fallacy. What is your opinion on that?
Absolutely. I agree with you. There isn't a cutoff age, really. There's a lot of controversy that we talk about in terms of when to start, and that's a different conversation, but there's just as much controversy surrounding when to end, when to end doing routine mammograms. I think those of us who really do this routinely as a living and deal with the cancers, my feeling and my colleagues' feelings are that if you're in very good physical shape, and so many more of our seniors now are in great physical shape and great medical shape, etc., then I don't see any reason to stop getting mammograms just because of your age. Certainly, if you have someone who is medically very compromised, whose health is severely compromised, where any therapy for them would be at high risk, then that might be a patient I would be less inclined to do as much routine testing because their options will be limited for treatment. But I think that's an individual discussion that you should have with
Correct.
your doctor to kind of get a better sense of your personal health. But I have a lot of senior patients that are probably in better shape than I am, frankly. And so I don't see any reason to stop just because they reached a certain age.
So be vigilant no matter what age you are, and
Or gender.
hopefully this conversation will make everyone, especially men, raise the awareness for them that they need to also
Absolutely.
be very careful
Absolutely.
about that.
And there is that fear. There's a fear out there of, oh, I'm going to lose my hair, or I'm going to be nauseous and sick, or, I'm going to go through this torture of life, and then nothing's going to become of it. And, overall and generally, I think our cancer ability to cure cancer is now in the 60 to 70% range. And, 5 decades ago, it wasn't even close to that. So now we're seeing a big difference in how we can treat our patients. But isn't fear one of the biggest problems, especially our seniors face? Oh, I'm getting older, but I'm getting older, but I'm still driving my car. I'm still going over to the senior center. I'm still, playing volleyball, every 3 times a week. I mean, please, the quality of life of our seniors is totally different from what it was 5 decades ago.
Right,
Absolutely.
yeah. I have this fortunate position of I'm a oncology nurse navigator, so I have this. My only goal is to help answer questions, help navigate the patient, whether they're newly diagnosed or if they just so much to think as something is abnormal. They can call me or call the office. I will sit down with them and kind of help navigate where to go or who to see at that point. Or even if they're already diagnosed and undergoing treatment, there's so many misconceptions about side effects of treatment. We have so many more advanced therapies now where it's not going to give you nearly the same side effects as when I was giving chemo 10, 15 years ago. I've been an oncology nurse for almost 20 years. It's so much different now, and I'm really excited about that. So for me as a nurse, that's a big deal. I can actually allay a lot of those fears just talking to these patients.
Yeah, that's such a wonderful service that you provide, because that is so needed. Everybody, hearing those words, you have cancer, just it just changes your life. And to know they have an advocate and somebody who's looking out for them, helping them get through the system, that just means everything. So it's wonderful.
And a lot of our seniors don't understand the concept of a navigator, and I
Right.
think it's critically important for them to start hearing those words and someone you can turn to in times where you're just not sure about your situation. And I think, Tricia, that role that you are playing in all of this is critical for our patients, because that fear that I was talking about earlier, that will not dissipate, guaranteed. But some of it will be alleviated to a certain degree because they have you to call and talk to help them get through that time and those moments where they're really worried about it.
Correct. There's so many fake news out there. Social media is a big deal. So my role is to first and foremost educate, and I'm that unbiased person that they can talk to, and I can help connect them with the right people and
that's
the right appointments.
especially important for seniors, because they're already feeling vulnerable, getting up in years, and they're beginning to lose a lot of the things that they were able to do, and they might feel that they're not being treated fairly, and to have someone like you, as you said, who is unbiased, to help walk them through this is so important.
And the great thing about it, to kind of especially reflect on what you were saying earlier, treatment options for senior patients have changed significantly compared to even 5 years ago. A lot of our agents now that we use for medical therapy, and I use that word deliberately, not chemotherapy, because we use a lot of medications that are directed toward hormonal control, for example, for breast cancer, and those come in the form of pills that you take. You don't have the side effects of nausea, vomiting, losing your hair, etc. In fact, for most women who take it, they barely even notice, and I tell them it's like taking a vitamin a day. At worst, they might develop a little bit of menopausal symptoms for a brief period, and then they adjust, and those go away. So they are very very well tolerated, and they're very, very effective. And they're part of why we can treat early breast cancers much more effectively by doing less. Surgeries now, most of my surgeries I do are what are called lumpectomies, where we only remove part of the breast, a small portion. I don't need to remove the entire breast. That's a much smaller surgery, much quicker recovery time, and it's tolerated almost any age. Again, with some health issues, of course, that being under consideration. But for a healthy person, those are very easy to do relative to how it was treated years ago. So while it's never going to be easy to deal with a diagnosis of cancer, especially breast cancer, but certainly the treatment options and the success as well as the tolerance level have gotten so much better that that's the first thing I try to allay the fear of when I have a patient sitting in front of me, is to go through that so that they know it's rare now, relatively speaking, that patients this age group need to go through the kind of treatments that you've described in the past.
That's so good to know, because I don't think a lot of people are aware of that. And yes, that it's not just the disease, it's the treatment that they're afraid of. And it sounds like there's a lot of breakthroughs, and possibly City of Hope has been
Absolutely.
responsible for a lot
Also,
of that.
the
we'd like to think
access
so.
care. I just want to point out the access to care here in Santa Clarita. I've lived here 19 years, and like what you said, Dr. Dorio, there was only dirt here.
Yeah.
Over 19 years ago. Now there's so many more specialties. You don't have to go far to get treatment, or even just a second opinion. If you're going through something right now and you feel like you need that second opinion from another doctor just to validate what was said to you, and whether you are going through the right path as far as getting the right treatment.
And speaking for City of Hope, we have a great relationship and great partnership going on with Providence, and we're very happy about that. And it's allowed us to be able to provide a lot of services locally. But we also work with the local hospital here too. We work with Henry Mayo. We work with physicians in the community, specialists as well as primary care physicians. So patients really are being offered the opportunity to take care of all their needs here in Santa Clarita. They don't have to travel. It is actually fairly rare that our patients now have to travel to City of Hope itself in Duarte, for example, for any treatment. Those are the much more the exceptions. The rule is the people get all their treatments here locally, and it's the same quality as if at least that's what we're hoping to provide, the same quality that they would get whether they go to City of Hope in Duarte or not. I like to think we are providing that level of service, of course, but that is our goal, and we're working towards that and expanding our services as we continue to grow.
And ultimately, I look at science and technology is always evolving, and we've taken a step into hormonal therapy. I mean, before in the past, radiate, take it out, give them chemotherapy, blah, 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 blah. And those were the options that we had. But now with hormonal therapy, I'm looking that we will have genetic therapy. And once we have genetic therapy, that will be the cure. And we're able to take the cell itself, the tumor itself that's multiplying like crazy, and able to inject something that will go into the cells, change the genetic makeup, and stop the cell from replicating. Boom, you're cured. And my thought is that 20 years from now, Dr. Chu, you might have a better idea for me, but 20 years from now, when we are in that territory, we'll be calling things cancer a cure, and our children and our grandchildren will say, "What was cancer?
Exactly.
I heard about cancer. That was a problem." I am of the firm belief that is that going to be out there. But dreams are.
That you will be out of business.
Well, you know what? I will be I'm the first one to say. I'll be the first person to say that if I am ever out of a job because cancer has been cured, I will happily go do something else or lay on the beach. We'll see. But I think you're absolutely right. We're making strides towards that. With when I mentioned hormone therapy earlier, that's a very specific targeted therapy, and we have other things we're using. We're able to now manipulate the immune system to do a little bit of what you just described. We're not quite that sophisticated yet, but we're using that and able the immune system, your own body's immune system, to either deliver medications, specifically to cancer cells, or at least revving it up so that maybe you can fight fight the cancer a little bit better and have your own body be able to do that, or tolerate treatment. So we're looking at different ways that we can sort of manipulate your own native body to do what it's supposed to do. And I think, that's just around the corner. I think
We are there, aren't we?
we're almost there.
And Santa Clarita, because of City of Hope, will be there as well. And I'm just so
Well, it's part
glad
of the
that you are in this community and have an office here now treating patients, and it's very exciting. I know many of your other colleagues who are now here as well, and you bring a level of care, a standard of care that has enhanced the medical treatment in this community, giving us the opportunity to survive and live and have that, our seniors have that quality of life. So thank you both for being here. Tricia,
Thank you so
Eugenio, now to get a hold of you, Tricia, your phone number I have down here is 626-218-1881.
Correct.
Is that correct?
Correct.
And
And the City of Hope office is 661-799-1999.
Tricia, thanks for being on the show.
You're
Dr.
welcome.
Chu, thank you for being on the show. Both
Thank
of
you
you
so much
for
for
bringing
having
this information to us. This is so important that we get this out there to our seniors and the people who reside here for many years, but to continue enhancing that life for many more years. Appreciate it. Thank you so
pleasure.
much.
Thank you so
Thank
much. It was a
you.
pleasure. Thank you.
I'm Dr. Gene Dorio with my co-host Robin Clow on your hometown station AM 1220 KHTS.